Welcome to this explainer. Today, we're unpacking something that affects literally every single one of us, yet it usually operates entirely behind the scenes: your health data. Just imagine you're traveling and you end up in an emergency room. The doctors there need your medical history immediately. But the incredibly high stakes of modern medicine are constantly colliding with a massive, frustrating hurdle: fragmented healthcare data.
Think about your own medical footprint for a second. You've got vitals from a routine checkup, lab results from a specialist, imaging from that time you twisted your ankle, and maybe even some advanced genomic data. For decades, these absolutely vital pieces of the puzzle have been trapped in isolated, disconnected hospital systems. I mean, we had this massive paper-to-digital transformation, sure, but instead of creating one unified network, we basically built thousands of digital walled gardens that flat-out refuse to talk to each other. Which leads us to the core technical challenge we're facing today. How do we connect them? How do we take thousands of stubborn, siloed databases and unite them into a continuous stream of life-saving information? Well, a technological revolution is actively tearing down those walls right now, uniting our medical footprints and completely redefining what modern medicine looks like.
Okay, let's dive right into this. Section 1. Inside the modern EHR.
You've probably heard the terms EMR and EHR thrown around a lot. Let's clear that up real quick. An EMR, or electronic medical record, is basically just the digital version of a paper chart at one specific doctor's office. It's totally localized. But an EHR, an electronic health record, is something much, much more powerful. It's a systematized, longitudinal collection of your health data, and it's designed specifically to be shared across diverse care settings. Essentially, it's built to follow you everywhere.
And when we say a collection of data, we mean the whole shebang. An EHR is incredibly comprehensive. It tracks your demographics, your active medications, your allergies, and your lab results over time. It holds all the clinical notes from your physicians, and most incredibly, it's now expanding to house your genomic data, literally the very DNA blueprints that make you, you. Having this single, modifiable file massively reduces the risk of lost paperwork or duplicate testing, and it perfectly captures your state of health across time.
Moving on to the core problem solver: bridging systems with FHIR. For the longest time, the healthcare industry relied on something called HL7 version 2. It was a traditional messaging standard created way back in 1989. And hey, it worked, but it was incredibly clunky and super expensive to integrate. Enter FHIR, Fast Healthcare Interoperability Resources. FHIR is the modern upgrade we desperately needed. Instead of that old-school messaging, FHIR uses lightning-fast, web-friendly APIs and JSON data exchange. Think of it this way. It basically takes the exact same seamless technology that allows your phone's weather app to pull data from global satellites and applies it directly to your medical records.
Now, what's really interesting about this slide is the ecosystem that FHIR actually creates. Notice how the patient sits right at the center, directly accessing their own data on a smartphone, while providers and payers are plugged into the exact same secure network. Because FHIR is standardized and freely available, massive market leaders like Epic and Cerner, who together cover over 80% of hospitals, can finally seamlessly communicate. It literally takes the friction out of healthcare data exchange, a real game changer.
Which brings us to a massive shift in the field: the bioinformatics convergence.
Translational bioinformatics is all about taking these colossal amounts of clinical big data from EHRs and merging it with genomic databases. And why are we doing this? Well, it's for fields like pharmacogenomics. That's figuring out exactly why a certain drug works absolute miracles for you but causes a severe reaction in someone else simply based on your molecular signature. Or take precision oncology, where doctors can actually sequence the DNA of a specific tumor to target it with bespoke, highly specific treatments. We are even predicting disease probabilities across entire populations using polygenic risk scores. Merging EHRs with bioinformatics is actively supercharging how fast we can recruit for clinical trials and develop truly personalized medicine.
But of course, we have to talk about privacy, security, and HIPAA.
Look, you absolutely cannot put sensitive clinical and genomic data out there without military-grade defenses. Healthcare organizations must deploy strict cybersecurity guardrails. We're talking AES encryption, ensuring your data is totally unreadable, whether it's sitting in a database or traveling between hospitals. We need multi-factor authentication, or MFA, using biometrics to stop unauthorized access dead in its tracks. And before your data is ever used for that bioinformatics research we just discussed, it goes through strict de-identification and hashing techniques, like SHA-256. Plus, to catch hackers, hospitals are deploying AI-driven threat monitoring, like SIEM solutions, to detect unusual network behavior in real time. And all of this is backed by strict, unalterable audit trails.
And governing all of this incredible technology is strict legal compliance. Regulations like HIPAA strictly mandate that patients retain ultimate autonomy and control over their records. You legally have the right to view your data, to demand corrections if something is wrong, and to strictly regulate exactly who can and cannot access your information. These rules exist purely to guarantee the ethical use of clinical data, making absolutely sure that as our systems become more connected, your fundamental privacy rights remain absolute.
Okay, let's bring it all together. The future of precision medicine.
The real-world payoff here is staggering. At a macro level, having an interoperable data network allows public health officials to conduct global pandemic surveillance. They can use automated data mining of EHRs to spot outbreaks before they spread. It allows for real-time epidemic forecasting. And over on the research side, it enables lightning-fast clinical trial recruitment because researchers can instantly find the exact patients who match a very specific genomic profile. From predicting the next flu wave to curing incredibly rare cancers through advanced precision oncology, this connected data is the engine making it all happen.
So, the crucial point is really this equation right here. Clinical data plus genomic data equals precision medicine. That is the ultimate takeaway of this explainer. We are no longer practicing one-size-fits-all healthcare. By connecting the systems that hold our vitals with the systems that map our DNA, we are officially entering an era of medicine that is tailored precisely to the individual.
And that leaves us with a pretty fascinating question to think about. How will your digital health footprint shape the future of medicine? Because your anonymized data, safely integrated into this incredible global network, might just hold the key to the very next major medical breakthrough. So think about that the next time you log into your patient portal. Thank you so much for joining me for this explainer. Keep exploring, and I'll see you in the next one.